Isfinaskhishafa dengan nomor induk mahasiswa P07134122092 dari Prodi D3 Teknologi Laboratorium Medis. In this video, I will give a little information about HIV/AIDS. Stay tuned. Let's know about HIV/AIDS. HIV, or human immunodeficiency virus, is a virus that damages the immune system by infecting and destroying CD4 cells. If more and more CD4 cells are destroyed, the body's immune system will weaken so that it is vulnerable to various diseases. HIV that is not treated immediately will develop into a serious condition called AIDS, or acute immunodeficiency syndromes. AIDS is the final stage of HIV infection. At this stage, the body's ability to fight infection is completely lost. Most sufferers experience a mild cold 2 until 6 weeks after becoming infected with HIV. The flu can be accompanied by other symptoms and can last for 1 until 2 weeks. In most cases, a person only finds out that he or she has HIV after seeing a doctor due to chronic diarrhea, pneumonia, brain toxoplasmosis, candidiasis, tuberculosis or TBC, caused by a weakened immune system. HIV transmission can occur through vaginal or anal sex, use of needles, and bottle transfusion. Although rare, HIV can also be passed from mother to child during pregnancy, childbirth, and breastfeeding. Patients who have been diagnosed with HIV should immediately receive treatment in the form of antiretroviral therapy or ARV. ARVs work to prevent the HIV virus from multiplying so it doesn't attack the immune system. In ART therapy, there are many drugs from HIV that are usually combined according to their use. Some types of antiretroviral drugs are: first, lopinavir; second, ritonavir; third, zidovudin; fourth, lamivudin. Here are some ways that can be done to avoid and minimize the transmission of HIV. First, not having sex before marriage. Second, do not change sexual partner. Third, using a condom during sexual intercourse. Fourth, avoiding drug use, especially injectable types. The last one is get the right information about HIV, how it is transmitted, prevention, and treatment, especially for teenagers. Group of people who are more at risk of infection include: first, people who have sex without a condom, either same-sex or heterosexual. Second, people who often make tattoos or do piercing. Third, people who are infected with other sexually transmitted diseases. Fourth, injecting drug users. And the last one, people who have sex with injecting drug users. Symptoms of HIV and AIDS. Symptoms of HIV and AIDS depends on the stage at which the person is infected. The first stage, number 1, does not cause any symptoms for several years. Second, patient will experience pain similar to the flu a few weeks after infection for 1 to 2 months. Third, there is fever, sore throat, rash, swollen lymph nodes, diarrhea, fatigue, muscles, and joint pain. Second stage. First, generally it causes no further symptoms for years. Second, the virus continues to spread and damage the immune system. Third, the patient can transmit the infection to other people. And the last one lasts up to 10 years or more. Third phase. First, the patient is vulnerable, so it is easy to get sick and will continue to become AIDS. Second, persistent fever for more than 10 days. Third, tired all the time. Fourth, it's hard to breathe. Fifth, diarrhea that is severe and over a long period of time. Sixth, yeast infection occur in the throat, mouth, and vagina. 7. Purple spot appear on the skin that won't go away. The last one, loss of appetite resulting in drastic weight loss. HIV and AIDS diagnosis. An HIV test must be done to make sure a person has HIV or not. The examination carried out as a diagnosis step is to take a sample of the patient's blood or urine to be studied in the laboratory. Type of test to detect HIV, among others. First, antibody test. This test aims to detect antibodies produced by the body to fight HIV infection, although accurate. It can take 3 until 12 weeks for the number of antibodies in the body to be high enough to be detected during an examination. Second, antigen test. The antigen test aims to detect a protein that is part of the HIV virus, namely P24. The antigen test can be done 2 until 6 weeks after a person suspects of being infected with HIV. If then screening shows the person is infected with HIV or HIV positive, the person will need to undergo further tests. The goal is to confirm the result of the screening, help doctors to stage of the infection, and determine the appropriate treatment method. This test is done by taking a sample of the patient blood. For further investigation in the laboratory, their tests include: third, CD4 cell or cell cloud. CD4 is part of the white blood cells that are destroyed by HIV. A normal CD4 account is in the range of 500 until 1,400 cells per cubic millimeters of blood. AIDS occur when the CD4 cells is below 200 cells per cubic millimeter of blood. 4. Viral load or HIV RNA test aims to count RNA, the part of HIV virus that functions to reproduce. The amount of RNA is more than 100,000 copies per millimeter of blood, indicating that HIV infection has just occurred or is not being treated, while the amount of RNA, which is below 100 copies per millimeter of blood, indicates the development of the virus is not too fast, but damage to the immune system is still occur. 5. Resistance or immunity. This is done to determine what kind of anti-HIV drug is right for the sufferers. This is because some sufferers have resistance to certain drugs. Remembering how dangerous HIV/AIDS is to make us aware for our health. We will not know that we have HIV/AIDS or not if we do not do an examination first. Therefore, it is very good if we use ways to avoid HIV/AIDS because disease will not look at age, social case, even economy to attack. Healthy national, strong country. I hope the information I convey in this video can be useful and provide new knowledge for all of us. Thank you for watching my video. See you!